So to have updates further on type 1 diabetes, I would like to call upon Professor Dr. Zaman Sheikh, who is an endocrinologist at the Syed Institute of Diabetes and Endocrinology, also the ex-director of National Institute of Diabetes and Endocrinology. So kindly join us on stage. Thank you.
Rahim. It's nice to see our worthy Health Minister, Professor Javed Akram, with us. I don't know how he takes enough time to attend all the sessions. And I'm grateful to PSIM team, especially Soumya Iqtidar, who invited me and made arrangements, and Jamil Siddiqui and team. So let us begin our topic. My topic today is novel ways, new ways in the management of type 2 diabetes. ये ऐसा है जिस तरह दरिया को कूज़े में बंद करना, because there are so many developments in the field of type 1 diabetes. They cannot be actually covered in 20 minutes, but I will try my best to finish them in 19 minutes, 1 minute before 20 minutes. Before going further, I must announce that by no means I insist that you use these very costly new drugs or new gadgets, new instruments. They are for information. Many are not yet available, and some are available in the world, in Pakistan, and some soon to come. This is my conflict of interest. Okay, so this is very famous slide from UKPDS. UKPDS started 1977, finished in 1997, 20-year study. And this showed that meticulous control of blood sugar prevented only 30% of complication. Why not 100%? When we are meticulously controlling hyperglycemia to the extent that hypoglycemia started occurring, why not 100% prevention? This means we don't know diabetes yet. We know only 30% of diabetes, 70% still we don't know. So we will see these new drugs, new gadgets coming on, because we are not near goal of treatment of type 1 or type 2 diabetes. This is one news from one newspaper in 1916 when there was no insulin. It says that if you drink good whiskey, it will treat diabetes, because no drug was available, even insulin was not available. And that is true, because when you take alcohol, there is hypoglycemia, because our liver is busy in fighting with the toxins of ethanol. So it has got little time to do glycogenolysis. So less sugar in the blood causing hypoglycemia, I mean acute binge of alcohol drinking. So ajib wa gharib harkatein karte the, because nothing was available for the management. Fortunately, this is very famous picture. I don't want to go into detail. Nobel Prize, University of Toronto, 1922. And this child was going to die, this wasted child. And fortunately, insulin came and he survived. So it is Ab-e Hayat. So this is in progress in monitoring. 1300 BC, this was the way to diagnose diabetes. Insect coming to urine drops. Then came glucometers, then came new gadgets, which we will talk shortly. And we also saw that period in which we used to taste urine. You heat the urine, put some solution, you see the change in color, and make a diagnosis. The blood sugar is +1, +2. This is innocent question from children of type 1 diabetes. How long we are going to measure blood glucose? Very innocent question, and the answer is lifelong. This is how injection therapy feels. 1,460 shots a year in order to stay alive for whole life. A few statistics which we cannot ignore. Type 1 diabetes, if you use 4 injections per day for 50 years, they become 73,000 injections. So, and moreover, it is not fixed dose, like in tuberculosis, like in cancer chemotherapy, there is fixed dose, not very much complicated change of doses daily. Here in insulin, you see diet, exercise, hormonal changes, sickness, examination, traveling, stress, even traveling. We think that traveling is a pleasure. It may be stress. Yesterday I missed my first flight. Second flight was 4-hour delay. It was stress, although I was traveling. So many stresses, and it affects blood sugar level if you are diabetic. And blood sugar measurement from 1 to 7 per day, average is 5. 5 tests per day, and for 50 years they come 91,000 plus prick. So much torture. These are challenges in Pakistan in managing type 1 diabetes: lack of awareness, poverty, and lack of resources, distance to clinic, and so on. We know very well. Especially, situation is worse in Pakistan. And this is in the center, a newly diagnosed type 1 diabetes person, and he is surrounded by so many problems when diagnosis is made for the first time. Now, what is type 1 diabetes? It is a chronic condition with progressive inability of the pancreas to secrete insulin because of cellular mediated autoimmune destruction of beta cell. Now, this last sentence is very important. We will talk more on this. And there is lifelong dependence on exogenous insulin up till now at this point of time. This is briefly pathophysiology of type 1 diabetes. Genetic predisposition 15%, not 50% as we see in type 2 diabetes, it is 15%. And then environmental insult like virus, autoimmunity, immunological response, beta cell destruction, and absolute lack of insulin in type 1 diabetes. Now, absolute lack doesn't come in one day. One day person is normal, second day 100% failure. It is gradual. And we take benefit of this gradual damage of beta cell. We try to surviving beta cells. This is pathophysiology of type 1 diabetes. Because of shortage of time, I cannot go into detail, but the result is death in few months if you don't treat with insulin because of these reasons. Now, insulin has changed a lot from 1991. Bovine, porcine insulin, human insulin, analog insulin, and much more. And we will try to tell something about this much more in the end. First of all, novel insulins. Once weekly insulin, name is icodec. These are series of studies, onward trials, 6 trials. So 1, 2, 3, 4, 5. First 5 trials are for type 2 diabetes, weekly insulin. Onward 6 is for type 1 diabetic. And this shows that versus degludec, which is basal insulin, this weekly insulin icodec is also basal insulin. So versus degludec, similar glycemic control, but slight higher hypo events. So it's a good news. In near future, we may see once weekly basal insulin, but we have to give parenteral insulin daily. These are smart insulin. We are using smart computers, smart cell phone. Now we will use smart insulin. They will sense the glucose. Higher the glucose, same dose will become more powerful because they have glucose sensor in the molecules of the insulin. Very slow release insulin. I talked about once weekly. 45 hours insulin might come. The name is pegylated insulin. Even 3-month insulin might come in near future. What is new about insulin pumps? In 1979, Tamborlain was the person, along with colleagues, who showed that for the first time that subcutaneous route can be used for continuous insulin delivery. And then there was concept of insulin pump. This was initial insulin pump, very heavy, and now we are using very delicate, small insulin pumps like this. This is semi-automatic insulin pump. and it is available in Pakistan, but there are two drawbacks. Number one, very expensive, 40,000-50,000 rupees per month expenditure. Very few people can afford. And number two, it needs lot of education. There was a workshop of 3 days from some company, and they actually imported this semi-automatic pump. And this education was so difficult that it was easy to drive like a pilot, you drive aeroplane. It was more easy. This insulin pump was more difficult. In 1922, insulin came, and now we are closed loop. Now, what is closed loop? It is fully automatic artificial pancreas. This we have got natural pancreas, and this is artificial pancreas. There are 3 parts. Number one, this sensor on this side, it senses interstitial fluid glucose 24 hours a day. And interstitial fluid glucose is equal to blood glucose. And it sends information through wireless technology to this pump. And same amount of insulin is injected in subcutaneous tissue, whatever is blood sugar. So this is closed loop or artificial pancreas. This is bihormonal. In one chamber there is insulin, in other chamber there is glucagon. So whenever there is more insulin, automatically glucagon is secreted, and it balances the hypoglycemic effect of the insulin. So no hypoglycemia. This is patient interaction. This is artificial intelligence. Here the educator talks with the patient. Patient will not go to clinic, and they will talk on cell phone by these gadgets. Now, these are few problems with insulin pumps for which it is not ideal. It is not available for general public up till now because of these problems. So there are few safety measures like hypoalarm, auto shut, smart pumps, bionic pumps with glucagon and insulin, which I just mentioned. There are few delays when there is a danger of hypoglycemia. It's like if you apply a brake to a car will immediately stop. कार को ब्रेक लगाएंगे एकदम स्टॉप हो जाएगी. If you apply brake to a ship, it will go on for further few kilometers. So this is like insulin pump is like applying brake to ship. Hypoglycemia फिर भी जारी रहेगी even if you shut off the insulin pump. Now let us talk about latest glucometers. This is not a watch. This is glucometer. This is glucometer. This is also glucometer. People apply the instrument over here. It will sense the glucose in the ear lobule, and one can read the blood sugar. Achha, this is Dexcom 7. This is connected with 7 cell phones. 7 cell phones attached hota hai at a time. Child is in school, suppose in Karachi. Father is in USA. Mother is in London. Brother is in Khairpur. All will read the live blood glucose of the child who is in the classroom in the school. Now this is Abbott Freestyle Navigator, and this is available in Pakistan. Price is 26,000 average per month. Very expensive. Very few people can afford. Now CGM fully implantable subcutaneous instrument. You give small cut, put this instrument, and it will work for 6 months wirelessly. This is the technology, and this is the size. What is next in CGM? CGM is integrated with computer watch. So in the watch you will see the daily routine changes, what time patient is taking meal, what time he is doing exercise, and in this artificial intelligence will calculate these things and help the patient in the management. Now HbA1c, हम कहते हैं कि foot is in the oven and head is in the freezer. The bottom is not comfortable. So same is applied with the HbA1c. If blood sugar is 60 on one day, very low, on other day it is 260. Average is same. So HbA1c is not a perfect criteria to check blood sugar. So we need further instruments. This is 77. Up till now we are using this. We see the numbers. But this is continuous line. We see algorithm daily trend of the blood glucose. So this is 7-point SMPG, and this is continuous graph with the help of CGM. Now this is time in range versus point in range. We are using up till now point in range, but in future we will use time in range. We will see the curve of 24 hours. Now this is new invention. You put a lens with a sensor and it will sense glucose in the tear. So glucose in the blood, in the interstitial fluid, in the tears, it is same. So they try to check the blood glucose in the tears. And you wear glasses. In glasses there is another sensor. It senses the glucose. So just wear glasses, wear the lens, and you can check blood sugar 24 hours a day, anytime. Now this is another magic instrument. It is like a gel. You put a gel with the help of injection in the subcutaneous tissue. No surgery, no surgical cut. And it will sense the blood glucose 24 hours a day for 6 months. This is new invention, hopefully soon to come. This is fluorescent sensor with LED light. You see the color change and you will see the blood sugar. New insulin delivery modules. This is needle-free. New ways of administration of insulin, oral insulin, sublingual insulin, intranasal insulin. In future we will see, this is aphasia. This is patch of the insulin. It will be given by cutaneous patch. Now somebody asked about use of SGLT2 inhibitor. People are working on pramlintide, metformin, GLP-1 receptor agonist. These are studies on GLP-1 receptor agonist in type 1 diabetes. And this is semaglutide, latest study in September 2023. So hopefully GLP-1 will be used in type 1 diabetes along with insulin. Verapamil, old gold drug for hypertension, this will be used for delaying type 1 diabetes. Oral sotagliflozin along with insulin in type 1 diabetes, EMA approved. Stem cell therapy is on the way. This is stem cell therapy. And this is Lentidra FDA approved. This is like stem cell, beta cell, and they will be injected and cure type 1 diabetes. These are 2 trials done on this. And this is subcutaneous isolate cell transplant rather than injecting in portal vein. This is FDA approved drug to delay the onset of the diabetes for 2-3 years. There are 3 stages of type 1, normal blood sugar antibodies positive, abnormal blood sugar teplizumab given here, and this will prevent clinical diagnosis. The cost is 5 crore 82, 5 crore 82 lakh rupees for 14 days course. So very expensive. It is just a dream for we people, but it is FDA approved. Vaccination and type 1 diabetes. So many vaccinations are coming to prevent diabetes. This is the list, and lifestyle will continue, and thank you.